Well, today marks World Health Day and is the anniversary of the founding of the World Health Organization in 1948. The day is commemorated annually to draw public attention towards a particular issue. This year's theme focuses on urgent action that's needed to keep humans and the planet healthy as the world emerges out of the Covid-19 pandemic. For more on this, we're joined by United Nations Special Rapporteur on Health Rights, Dr. Tlaleng Mofokeng. Always good to speak to you, Dr. T. Welcome to News at Prime. So on this World Health Day, what is top of mind for you, especially in our context here in South Africa?
I think the most important is to realize that the climate crisis is not something that is yet to emerge in future, that in fact South Africa is one of many other countries who are already in fact experiencing some of the negative consequences of the climate change, but also the inaction globally of various sectors, but also various responsible ministries in responding to the issues of climate change. But those directly impact all of our rights to physical and mental health and well-being overall. So today it's about really discussing how the health of the planet is important, not just to keep us alive, but to keep us thriving.
And the World Health Organization estimates more than 13 million deaths globally due to what it says are avoidable environmental causes. Are we paying enough attention to that in the SADC region and in South Africa?
I'd say no, because even in our health data and in the manner that we report, we don't report enough of the disaggregated data that actually brings into the spotlight or into focus issues around environmental deaths, right, and the causes thereof. I know, for example, in the mining industry, there are particular requirements, right, in order for people to maintain their licenses in terms of reporting to the Ministry of Minerals. However, just as a public health issue in the primary and secondary health clinics, for example, I don't think we're paying enough attention to why people, for example, are developing particular cancers, respiratory illnesses, and of course heart disease. And we've seen with COVID, right, the impact has been severely on those with these particular comorbidities, resulting in death or severe illness. So this has been an important moment, I think, for global attention, but also urgent action.
And also to blame has been big business, hasn't it? I mean, we had a gentleman on the show 2 days ago when we were talking about a climate report from the United Nations, and one of the things he was telling us about was a situation in KZN around Durban where there are petrochemical operations underway, and he was saying a lot of people now are suffering with asthma and the like and get no compensation and are ill regularly.
It's very important, and I had an experience of being in Secunda recently, and it's undeniable the differences in air quality. And I think the state has the ultimate obligation, and South Africa has ratified many international human rights standards and consensus documents, but also specifically recognizes the right to health in its entirety. And so environmental health and the right to live in a healthy environment, but also a healthy work environment, because Tembegile, many of these illnesses that people suffer, right, as individuals, actually result as because of the work that they do. So companies have a particular role to play in maintaining and respecting human rights, and states have an obligation to ensure that third parties do not actually, limit people's rights. So it's very important to have a conversation around what are the principles and the guiding principles of business and how they intersect with human rights, to make sure that when we talk about the right to develop, when we talk about industrialization, when we talk about development, for example, in the Eastern Cape, we just had recent court processes around shelling there. We need to be having these conversations within a human rights perspective. It's not just the right of business to make profits. It's also the rights of people, and mostly indigenous people who have a right to clean air, water, as well as land.
And the World Health Organization says about 400 million people, in fact, in sub-Saharan Africa lack access to clean drinking water. When you look at that situation, yes, some of the countries have more complex issues, but to a degree, a lack of proper political leadership also plays a role in their suffering, does it not?
Absolutely. And I think it's important, especially now, when we are sort of out of that immediate acute catastrophic moment, right, of the pandemic, is a lot of people are now starting to talk about the post-COVID world. And I'm very guarded and very cautious to discuss a post-COVID world when so many poor people who are living in deprivation, right, and hardship, are still living through this particular pandemic unsupported and unaided. However, when the WHO, the United Nations, for example, starts to talk about accelerated action towards the SDG goals, we have to make sure that those programs that support the realization of those goals are rooted in human rights. Mm-hmm. We have to make sure, for example, that when we talk about development, we have meaningful participation of communities on the table. It's not enough to just put an advert in the newspaper and just say you've done your community participation as per the requirements. I think it has to be meaningful. We have to listen to what people need, because as much as governments may have their own perspective and their own agenda and targets, it's people who are navigating this poverty and this hardship on a daily basis who know for them what's most urgent, and they know for themselves what the solutions they need for their communities. And so we need to listen to communities a lot more than we are right now, even in that rush to try and meet the Sustainable Development Goals, which include, of course, partnerships, but very rightly, as you've said, the right to health and well-being, but water and sanitation as well.
And these are the same communities, many of the poorer communities, as we've seen in South Africa as well, who during the pandemic, the 2 years in which we were dealing with the very worst of COVID, were expected to maintain a certain level of hygiene. And you wonder, how do people do that when we still have areas in rural Eastern Cape, rural Limpopo, where people share streams, rivers with livestock? You've got people who are told you need to maintain a certain level of hygiene to be healthy, but they don't have regular refuse removal services. And that goes against that very issue of being healthy when you basically are forced to live in filth.
And this is why I think there has to be a bigger global call for a more coordinated effort to try and solve the problems that many communities are dealing with. A lot of the fallout, a lot of the negative impact results, of course, in violations and abuses to the right to health. However, I think there is an opportunity for us as the region, as a country, as a continent, but also more internationally, to really work across the silos and work across thematic areas. Because as a Ministry of Health, for example, you should be having conversations with your counterpart in water and sanitation, because you understand that even before COVID, young women and girls were already having issues with menstrual health and hygiene, and just trying to maintain that aspect of their life dignified. We now know with COVID what it meant for communities who could not access water at all. But there's also the issues of food security. How are communities cooking? How are women, who are still the ones who are doing most chores around the house, how are they cleaning the linen? How are they taking care of the elderly when there is poor sanitation and water? So I think it's important to have and really have not just conversations, but a national strategy in how to capacitate national governments to actually do the work themselves, as opposed to outsourcing it to third parties who may not necessarily, by the way, be held to the same international human rights standards, although states have obligations to limit what third parties do in terms of rights violations. But the truth is, for many communities to get justice, they have to go through the courts, and the courts remain inaccessible, they remain expensive. So we need to rethink about what thriving communities look like, what sustainable communities look like, and what role each one of us has to play in that. But I do think we really have to go beyond just working in the different silos. We have to think of a national plan. We have to have a vision for the region, a vision for the country that encompasses all of these very important human rights completely and not partially.
Dr. Tlaleng Mofokeng, United Nations Special Rapporteur on Rights to Health. Good to have your time as always. Thank you.